there any modifications to today's agenda?
I
If
don't have
not,
any changes.
No changes? I'll make a motion to approve the agenda.
I'll second that.
motion by Commissioner Dahl, and second by Commissioner Hewsom. Any further discussion? Hearing none. All in favor say aye.
Aye.
Opposed, same sign. Agenda is approved unanimously. Today's consent agenda. Does anyone like to pull anything off today's consent agenda for further discussion?
Mr. Chair,
Yes.
letter A, number 1, the reappointment for discussion.
All right. And with that, a motion to approve the agenda with the removal of A1?
Yes.
I'll
So
second
moved by Commissioner Catchmarket, second by Commissioner Hewsom. Any further discussion? Hearing none, all in favor say aye.
Aye.
Opposed, same sign. Consent agenda, A1.
Yes, Mr. Chair, thank you. So this was up for review a few months ago, and we talked about attendance, and at that time, by my count, for Mr. Franzen's attendance in 2+ years, there were 22 meetings, and he attended 8 of them for 36%, including being appointed to the vice president, at least one, maybe 2 of those terms.
Vice chair.
Vice chair?
Yeah, not
Okay.
vice president.
Okay. And then now we got updated attendance from 2021 through October, which by my math brings it to 41% attendance for 2019, 2020, and 2021. I don't think that's acceptable for attendance on a board like this.
Mr. Chair, Jamie,
Commissioner Wetter, go ahead.
what time are these meetings? Are
Well,
they-
it was today, so I think it must be the second Monday of the month. I think they can meet 9 times a year, and I think it's scheduled for 9 a.m. typically, 9 to 11 a.m. Commissioner DeLayden sits on this particular public health task force.
Okay.
We did implement, the kind of, I would call it a newer unexcused absence policy after we were with the board. It might have been July or August earlier this summer. So at that point, we did contact, at HSAC, we haven't done it yet with the Public Health Task Force. I don't think a mental health task force for people that had 3 absences, and we did actually reduce our HSAC committee members by 3 people that declined to respond after we sent them the letter. To date, Mr. Franzen has attended the last 2 meetings. I believe there may have been a job change at some point in the last year. I'm not really sure.
Yes, there has
I
been.
have not spoken with him probably in a number of years now. So when I think it's Tony Onen was not available in August. Jason Franzen did step up as vice chair to facilitate that meeting in August.
Mr. Chair?
Yes.
I'd make a motion to decline the reappointment of Mr. Franzen based on the attendance for 2019, 2020, and 21.
We have a motion by Commissioner Catchmark,
I'll second.
second by Commissioner Wetter. Discussion.
Yeah, Mr. Chair, Commissioner DeLayden, so, or I guess Jamie, what's the acceptable, I mean, they should be at least at half the meetings, I think, my personal belief, or 3/4 of them, or, if you're on a task force, you should be there, and sometimes things come up, and then you get an excused absence. And if it's just absent with no excuse, I don't know what that.
We don't have an acceptable versus an unacceptable level until we had our discussion a couple months ago, and when we determined it is difficult to do operationally to carry on the work of the task force if
Right.
there isn't a quorum to meet.
Yeah,
I feel bad denying somebody's, if they're willing to participate, but I certainly understand it's the board's prerogative to assign people to this task force. What other comment? So yeah, I think it's, I think intention isn't always what happens when, things it comes to And as Commissioner Whiter kind of pointed out, it's during the daytime. I think it's one of those issues, but I would agree that, obviously, we want people to be involved and engaged in our meetings.
And Mr. Chair, the thing is that they know when these meetings are. So when you volunteer to do something, you know when they are. And in a year's time, once or twice, something might come up where they can't be there. But yeah, I've sat in meetings and you can't vote because you don't have a quorum. And it sort of wastes everyone's time in a way because you have to repeat everything then the next time. And so
My one other observation would be, which is what I was forgetting to say, was a lot of areas we've just kind of decided to disregard 2020, just because a lot of people, it was a difficult year you'd think it'd be easier for attendance, but that's not what we saw in any of our task forces or our committees where you'd think more people would be available because we're doing it virtually. And it actually kind of appeared to be the opposite to be the case, that we had no more attendance when it was virtual. But again, I defer to you and what you think is acceptable as far as going forward.
Mr. Chair?
Yes.
And we can throw out 2020, you can say what you want about 2021, but 2019 was the first year when you think people got the most energy and ambition, 2 of 9. 2 out of 9 meetings.
And Commissioner Ketchmark, I guess I especially because we're paying per diems on these things too, so we're not. I mean, we're even incentivizing them to come. So then you really have to, because we understand it's during the day, so there may be a loss to them. So that's, I agree, because we have to have people that are really interested into it. I ideally like to tell people before you go and do this type of action, first of all, that if you can't attend them, we'd respectfully ask that you resign, because we'd rather not have to do it in this fashion, but.
Right.
Mr. Chair?
Yes.
This is Commissioner Ketchmark's district, and he does have the right to appoint somebody that he prefers or he thinks will do a better job of serving the public health task force.
We have a motion and we have a second out there. Is there any other discussion on it?
Mr. Chair?
Yes.
I do know, and I'm not sure which year it was, if it was last year, the year before, he had broke his leg. And he wasn't going anywhere for a long time because it was a severe break. And I do know he changed his job where he's a trucker. And has he requested to be on, to continue or not?
Well, actually, the task force meeting was this morning. I think typically, we notify them that the reappointment is coming up and whether they were seeking a reappointment or not. So, and I don't see Sarah. Sarah, you're here. Do you know?
Yeah. So that's Amy does that every time before bringing them to board. We have to make sure that.
So he was still interested then.
And Mr. Chair, or not Mr. Chair, but I guess the one thing is, like, when I see absent here, that means that there was a lack of communication for the reason for not attending. And I mean, there really isn't. It's not hard to get an excused absence if you communicate for not coming. Just not showing is just.
Right.
We had not adopted that policy, so we didn't. The staff that are assigned to the group was not keeping prior to the communication that we had, or the conversation we had a few months ago. So now we are managing that, and we let everybody know, sort of level set, this is the expectation. You'll be absent, again, this is what the policy says. And we have a few other people we need to communicate with.
So potentially he could have sent in an email at the time, we were not recording them as excused versus unexcused absences, but I don't know what the status is.
So now they understand that, basically?
We've had, I believe we've made the same across all our advisory.
All three when?
All 3 advisory committees. So the Mental Health Advisory Board.
All right. Well, do we have any other further discussion on this matter?
Well, his end of term isn't until the end of this year.
We have one more meeting.
You want to reach out to him? And then we can make the decision.
Mr. Chair, this is the second time we're revisiting this. And, no, I don't see, I mean, he didn't submit anything on his behalf. I mean, we're looking around, did he express interest in reappointment? There isn't anything to say, oh, I'm sorry, it was miscommunication, it was this or it's that. I don't see any reason to make any exceptions or prolong it any further. So I'll call the question.
All right. The question's been called on the matter. We'll take a vote. All in favor say aye.
Aye.
Oppose?
Aye.
Oh, you.
2 ayes.
Two ayes, all right.
I'm sorry.
All right. Opposed, same sign?
I guess I'm really on the fence here, but
I'm gonna abstain because I think we got a chance to talk about it with him and then, since he doesn't have to be reappointed until the end of December.
I did let him know that there was some concerns about his attendance after the last meeting.
All right, well, we're gonna put this item to bed, yeah, I guess, because it'll be a 3-1 with 1 abstention. With my vote counted, he can always reapply, because we're gonna put it back out there, he can reapply, but I think it's at this point prudent to just go through a whole reapplication process and solicit to the general public versus implying internally. I will also defer to Commissioner Catchmark for the reason my vote, it is his district, and he has done his due diligence in questioning the motivation the interest for this individual being on this board and the lack of their attendance. So with that, motion passes.
Thank you, and I do appreciate the board's attention to these matters because it does impact our organization and how we run our business, so thank you.
All right.
Sarah?
I'm sorry, I was slow.
No, you're good. It was almost like a virtual eye. Like like sometimes I ask for a vote, and all of a sudden I get one that comes a couple minutes later.
I'm sorry.
No, it was the fun part of the meeting.
Yes, we get to meet
gotta
all
wake
of our new hires,
Yeah.
and you all get to sing us a song.
yay.
Oh, did I mention that? I don't know if I mentioned that.
We're big about singing here and having staff sing to the board, so
Michelle will start you off,
yes,
'cause she's really good at singing.
that's how she gets new positions.
That's what we don't tell you to get you here. Just kidding. So board, I have, as you mentioned, quite a few new hires here, and I'd like to start by introducing Holly Ryland. She's our new eligibility, go ahead and stand up, Holly. She's our new eligibility specialist in our adult family financial services and long-term care, and she started on August 30th. So welcome, and she reports to Michelle Zach. So welcome, Holly.
Well, No, I said this is the fun part of the meeting. So what song are we gonna sing us?
Yes.
No, I'm just kidding. A few things that you might as well know. We just like to know where you're from, where you live now, why you chose to work for the right county instead of all those other places out there in the state of Minnesota. No, I'm just kidding about the last one.
Because the eligibility specialist area is like the best area to get employed in Wright County. They have the most fun, right, Michelle? I regularly visit those folks there. It is a fun time. So
So where are you from?
I'm originally from Sartell. I currently live in Becker. And I chose this work of field because I like to help people. I did daycare for 6 years out of my home. Before that, I worked for a bank for 12 years. So interacting with people.
So when are you gonna move to the Wright County?
Funny you mentioned that. I'm actually putting my house on the market to move closer.
Yeah.
just trying to escape the increased taxes of loss of capacity from the Sherco plant.
From the power plant?
Yeah.
Thank you, Holly. How has the first month gone so far?
It's been good. I've learned a lot, and I'm still learning, and it's a great challenge. I work with a bunch of great people,
Even your boss?
even my boss.
Okay.
Next, I have Derek Johnson. So Derek is a social worker in our mental and chemical health team. He reports to Diane, I believe. There she is.
Oh, I'm
He
sorry.
started with us on September 20th. The same questions, Derek.
Originally from Wilmer, Minnesota, currently live north of Grove City. And I've been in charge of the Eastern Division for the previous company I work with, and I know quite a few of the case managers that are from Wright County, so.
Well, good,
Welcome.
welcome.
Yeah. A little commute, but not as far as Wilmer.
But I am moving in the right direction.
Yes. Welcome.
Thank you, Derek.
So you get the right word in there.
Del Percio Martinez. Am I close?
You got it.
Oh, great. Valerie is a new social worker with our assessment team. And she started with us the same day as Derek on September 20th, and I believe you must report to Rochelle.
Yes.
Okay.
Yeah, so I'm kind of from all over. I have a statewide background, but my origin family is Coast. I go home for the years. And my husband and I actually just moved to Otsego. So,
Do you know which one of these people is your commissioner?
to be honest, no. We like just moved a couple months ago.
And which part of St. Mike,
Otsego.
which part of St. Michael did you live in before?
The South Port, near the new Cub.
It's east 19.
So it was east of 19, County
Yes.
Road 19.
Yeah.
All right.
Yeah.
So if you didn't like me there, you're not gonna like me in Otsego either.
I'll ask my parents
Simple as
about it.
that.
So what do you know about this Mark the Light?
Yeah, and I wanted to work for Wright County because it's like home base. And be involved.
Welcome.
We also have two brand new staff that just started today, actually 3 staff who just started today. So our Anna Heikkinen. Anna is a new eligibility specialist on our healthcare team. She reports to Tammy. Started today.
Hi. I grew up, but I live in Michael with my husband. Love Wright County. My husband grew up in Wright County. I used to work for Rockford Elementary. My husband works in Wright County too, so
Where's he work?
he works as a probation.
Oh,
We have a spy in each of the departments.
Welcome.
Welcome.
Lisa Conlon, eligibility specialist on the healthcare team, and she started today, and she also reports to Tammy.
I've been in Michael for years. I wanted to come here. I have a girlfriend that works upstairs. She's been here a couple of years and always talks so much of it and thought, what the heck? And here I am. I'm here.
Welcome.
Wonderful, thank you. And then we have a repeat performer. So Christina Peters is our ISS on our technology team. She reports to Jim. She was with us before. She had to leave us through no fault of anybody's, and we were so happy to bring her back. So she started back again today.
I grew up in Big Lake, and then about 12 years ago, we moved to Buffalo. So it's close to Buffalo, and that's where we Wright County. So I live in Wright County, and I just like close to home. Keeps me busy.
how long did you work here last time?
About a half a year.
Was it Jim, the reason?
Yes.
Jim, you can be honest.
No, not.
Very nice. Thank
Yeah.
you.
Well, I want to
Welcome
welcome
back.
all of you to the Wright County.
Yes.
And hopefully you will find this to be home forever. Because we have some really hard things if you decide to leave us. And obviously, it's worked because she came back.
That's right. Happy to come back.
So since the new employees delegated their singing to the employee of the month, so our employee of the month will have to sing for us.
And actually, I'm going to invite Robin to come to the.
What song are we gonna get?
I liked it with the
Can't do
mouth
this to my
was
staff,
so
or no one will
open.
ever want to be anything ever again. So our November employee of the month is Robin Dorff. She's a case aide assisting our truancy team in intake and intervention. Robin joined Wright County in 2008. Robin's nominator states, Robin handled an increase in truancy and educational neglect referrals of over 236% this school year, and she has done so with such grace and professionalism. Robin continues to assist team members with backup coverage, helping with training and gathering information on cases so proper updates could be made to the courts. Robin built strong relationships with school professionals, connects with the county attorney's office, keeping the truancy team informed, especially when it's time to pass along a case for intervention. Because of Robin's diligence and outstanding efforts, referrals went from 350 in a normal school year to 1,177 this past year, with children and youth getting their attendance back on track. Robin returns phone calls promptly and helps families identify barriers for academic success and improved attendance. We really appreciate all that Robin does. So thank you, Robin, for your dedication and commitment to strengthen, support, and serve. Congratulations on being our HHS November Employee of the Month.
Thank you.
Wait a minute, you're not getting off that easy.
Run quick.
Would you like to say anything, Robin?
Just thank you.
Do you, has this year been a little better with the truancy, or has it been about the same?
It started out better. I mean, it's starting to pick up now.
The truancy part is?
Yeah, it's just, I would say within the last, advisors here I'm looking at, within the last couple of weeks, it's starting to pick up.
So now, regarding truancy, that is just, they don't call in and say that their child's gonna be excused or sick or
Some
something?
don't call,
No
some call, some just, yeah.
Oh, so if they even call and say they're
Well,
sick?
sometimes they call in for personal reasons like mental health or something else going on. The parents are still in communication with the school. But, and we have to go off of the school district and how they mark the attendance. So we're looking at unexcused, just the unexcused. We don't look at ill or personal or unexcused tardies. We don't look at any of that stuff. It's just unexcused where there's no reason.
So it's the school district that dictates that then? Okay.
And that's, we say that because if we were to go to court, our judges will pull in the school district's policy regarding their attendance, and we have to go off of that.
Is there quite a bit of differences between the school districts?
Yeah.
Some want us in there right off the bat, and other ones are more like, we've got it, oh, hey, we need you now.
Yeah.
So a little bit of difference.
Yeah, both.
That can be challenging,
Yeah.
Yes.
having to keep
That's
track
hence
of
our
all of
Employee
them.
of the Month.
Yeah.
And obviously well
Good choice,
deserved.
yeah.
Thank you.
Thank you.
So we'll let you off for singing this time.
So since the singing got kicked down to the next item, they were going to do the introduction of our new social services supervisor, who's going to sing for us.
No, you left that part out.
So Michelle would love to introduce Taryn Anderson, our new social service supervisor. As you may have heard, Chad Miller left us to try a new opportunity, kind of with the military background that he's been part of for a long time, and we were very happy to be able to promote one of our own. So go ahead and step up to the podium, Taryn.
I have let people know as we've been introducing Taryn that Chad wasn't just able to leave, lightly. We did a good job roasting him, and so you'd be proud. We didn't let him go easily. But anyway, we're super excited to have Taryn on board. She's been with us a number of years in children's mental health and adult mental health, and most recently as a therapist. So has kind of gotten to know really a lot of staff through her different roles, and has already done a great job jumping in as the youth services supervisor. So,
Thank you. Yeah, I'm very excited to be here. I'm originally from Park Rapids, Minnesota, and we moved to Monticello in 2008. I have kids in the district. I had the opportunity to start at Wright County as an intern in child protection, actually. Like Michelle said, did some mental health after that, adult mental health, and most recently therapy.
Now, which do you, for the social services, there's so many different ones, but you have it kind of broken down. So which group are you?
Youth services.
Youth services.
Yep. So we have children's mental health and adoption workers.
Challenging work.
I love it.
And we're getting her out to all the Safe Schools meetings, so if you are coming to the Safe Schools meetings, you will see Taryn.
Yes.
And you will
did.
hear this again.
Yes.
Are you gonna be introducing her then?
Well, mostly I say, Chad left, here's Taryn, and then Taryn.
Oh, okay. Maybe you should get her to sing that part. At least
I
make
wish
it
I
a little
could.
more interesting, you know?
I will drop it with me.
There's your chance. Sorry, Sharon, that's too bad.
Well, congratulations.
Yeah,
Thank you.
congratulations.
Actually, I think this was the only one I recall ever having, I think there was a one-day transition where Chad was still here and where Taryn was informed of the promotion, so she was able to get some input from Chad. So usually we have quite a distance between when one supervisor leaves before we can bring another one on board. So it was a happy instance where we were able to get them all together.
Were you able to get a good download then?
Yeah, just a brain download, yeah.
Right. Moving on here, we get to have the big discussion here on the opioid settlement status.
So Sarah will be providing that. As you may recall, Sarah serves on the governor's committee. I'll let her fill in the details. Was appointed to the governor's committee and is the only county representative on that committee.
That's a bad idea.
And she's no longer very young.
And Greg's here too, so if you want to make someone sing, I feel like we could just pass it.
We've heard Greg sing before, trust me.
Oh, you
We
have?
would not subject all these new employees to that, no way, no how.
No, these new employees will leave tomorrow.
I'm just gonna join the team so that I can share that. So Jamie's correct, I was, we let you all know when I was appointed as the public, what do I need?
Who else was on there? Sarah?
Who
What
there?
Yeah, what other type of people?
Probably a lot of people.
That type of
Yeah, so there are representatives from different treatment modalities, so both physicians, but also people who provide therapy. There's an alternative medicine representative, there's people who are in long-term recovery, a nonprofit, the nonprofit system is and then we have 4 legislators, they are voting members, 2 from the House and 2 from the Senate, 1 from each party. All of them have lived experience from their family members that are either they've lost or are in long-term recovery. No, I'm using these PDFs. We have been meeting, I don't know, we were meeting before the pandemic started.
long time.
Well, I mean, I think we had a couple of good meetings in person under our belt before we. And we continue to meet virtual. We'll do our first hybrid in-person meeting. And that money that council is directed is money that's from fees that are collected by the Board of Pharmacy, where Minnesota in House Bill, 400 adopted increased fees for our opioid prescribers, the providers, the manufacturers, and the distributors through the Board of Pharmacy. Those fees then go into a pot, and then we are able to distribute them. We're basically a grantor. And we approve an RFP process. 50% of those funds, before they even go out the door, go to child protection and for counties, and that was already written into the bill. And then there was some language to account for settlements, but I don't think when the bill passed, I think it'd be fair to say that nobody realized settlements were going to come as quickly, because we really only had an opportunity to go through the grantor process. The first time we had to pull our grant because we didn't have enough money because the fees came in lower than what was expected from the Board of Pharmacy, and we're going through an RFP process now. So we've only gone through it 1.5 times. So Michelle, how much did we get? Do you know off the top? It wasn't very much. some counties have, I mean, I know some smaller counties got like $15,000 for their 50% based on the measure that the amount that counties get for child protection, and that's the only area that it goes into was,
I thought it was like 50.
we got 50,000, that may be. I just know one of the, I think it was Sibley who said her amount was 17,000 meeting.
Was it based off of population or?
It's based on your rate of children in out-of-home care. So you get more money if you have more kids in out-of-home care, but we don't want kids in out-of-home care. So there's some, I think, philosophical concerns about the metric that you're trying to reduce. Actually, you're disincentivized, right? Because you get less. So, but now there's settlement, which is a lot of money. So the settlement terms, Minnesota joined the settlement August 20th. It's $26 billion across multiple years, and that's for the whole nation. And then there will be the Purdue bankruptcy money rolled into that as well. I'm just these are slides that were provided to me from the AG's office. I missed a step in this presentation, but so you will have a big meeting. I'm sure Greg will facilitate all of it when you're going to decide what you're going to do. But in the meantime, the AG's office was signed on to this settlement, but none of the litigant counties or cities have signed on to it. And the settlements were arranged differently and sort of a little bit in a response to how the tobacco settlements went, and in ways that maybe people didn't appreciate about the tobacco settlements. One of which is that the money has to be spent on opioid abatement and remediation. So you can't put the money, the state can't just put it into the general fund and say, oh, we got our, our slice of $25 billion, we're gonna lower everybody's taxes. So that's one piece, and the other piece is that the folks that are being sued really don't want to be sued by all the counties again or the cities again. They want this term that I'm going to say wrong. It is global peace. So they want everyone to agree. So we will be asked as a litigant county, but anybody with a population over 10,000 will have to sign off. And the more that sign off, we have to get a certain threshold, the state does, to actually get funds, and the more we get incentivized through the settlement. And that's all that was arranged between the attorneys at the big level. So why am I here right now talking to you is there's been a combination of the group that I sit on and some folks across Minnesota, generally county folks, because as Jamie mentioned, I've been the only county person at this group. That means there's no representation for jails, there's no representation for human services, probation, any of those areas. So I've been trying my best to fill in those gaps when or connecting people when those conversations come up, and AMC has been very helpful in facilitating those conversations because we've been able to have other speakers come in to help broaden the group's understanding of what counties do and how counties have been impacted by the opioid epidemic. They've brought in a bunch of county folks. There's some commissioners involved as well, and they are, we are now meeting until the, we're meeting till November 5th, and our mission is to determine the allocation of funds between the state and local governments, including shared funding structures, propose what the funds can be used for. There's some of that is guided by the settlement, and obviously you saw 85% has to be for opioid-related activities, but that can be really broad. In fact, Commissioner Delight and I got some good feedback, I think, from some of our task force members this morning about things they were interested in having funded. And then there are going to be grant-making, reporting, and auditing requirements that go with any fund amount. So we have to have all of those conversations before the end of November. So if you thought all I did was COVID, this has been a wonderful distraction. I love this kind of wonky policy stuff. So, but there are quite a few cooks in the kitchen, so we have kind of there's over 20 of us trying to come to agreement. So that'll be interesting.
Well, I mean, that's only 20. I mean, look at the legislators.
That's true. I will take that as, I will find that as my ray of sunshine.
If the goal is global peace, I would
Yeah.
say.
Yeah, I know. school. I didn't get a chance to ask Greg, but you've gotten this, right? This local notice?
Yeah.
Okay, yeah.
Yeah, I've seen it numerous times.
Okay, good. I think I send everything to Greg that I get, so he gets even what the group is working on, which is probably more than what other counties get. So eventually you'll have to sign some type of agreement, and the reason being is, to be very transparent here, is that right now the default settlement, if we don't come up with anything different in our global peace discussion with all of our political subdivisions, is that 15% goes to the counties and cities, 15% goes to the state, and 70% will go for abatement, but it all goes to the council. And again, that's the council where I am one vote out of 15 representing counties. So we're grossly underrepresented. I'm going to be very straightforward. Grossly represented under the council. I don't think that would be good. And under current law, 50% of that money goes only to child protection. And not that Shell doesn't want those funds, but I'm sure there are other things in other parts of the county when you instituted this lawsuit that you might want to fund. Just thinking. You know, in our current laws, that 50% sharing is for grant making. We don't really have a process other than a competitive RFP right now through the Department of Human Services on how to distribute those funds. So it's not like we could say, even through our process as a council, we're going to give everybody equal share or whatever. And then 50%, as I said, goes to that counties and tribes for child protection. But there are states who've already come up with their own settlement structure, which you are allowed to do. Two of them, I know Julie Ring has brought in North Carolina, so their executive director of their counties association presented to the AMC board, as well as the executive committee. And I watched some of that presentation. You know, their structure, government structure for, particularly for human services, is very similar to how Minnesota does it, where it's, you have state statutes and state rules that you follow, but it's all local administered. And having been in Wisconsin, I can tell you the structure is very similar in Wisconsin. And you can see both of those local agreements are an 70 or 80% split. So our full intent is to see a greater share to the counties than what would go to the state for mediation. If there's some other perspective you'd like me to share with the group, I can.
No, I guess how did they determine that it would be used for child protection services as opposed to, you know, since it's the opioid settlement, you know, is that where they feel the opioid thing is impacted our society most, or what?
I think, so the House File 400 was passed in 2019? Probably summer of 2019, because we were able to meet several times right after it was filed. And that was part of the legislature's plan for those funds, was that 50% would be for child protection. I think the legislators thought they were helping the counties with their hardest pain point at the time. There's not a lot of, I'm gonna be honest, I mean, we have like 11 or 12 million dollars. I'd have to look at the first time around, we didn't have enough to even do any grant making, as I mentioned. And I believe the distribution to the counties didn't go very smoothly. If I remember, you were given an amount and then it was like almost halved.
Yeah, we were given 150 and then.
Yeah. So,
our child protection was providing to the original, the attorneys that were first looking into this for the state of Minnesota, a lot of information regarding the rates of children that are in placement because of either neglect or through substance abuse, parental substance abuse.
Okay,
so.
yeah, I'm curious how they determine.
I think I'm going to say they were doing something, they have done something innovative, and the law has opened every session since then and been tweaked a little bit because there is no other example. And we knew how much we were expecting. They had audit, I'm sure auditors tell them with the bill costs, what they would expect from fees, and they had some projections. Obviously, they were
a little bit high. But no one thought about settlements, I don't think, other than to say if there is a settlement, the money goes into this pot. Otherwise it is silent on settlement. You can see it's even silent on a state and local split of any kind of large settlement. We just didn't think it was coming, I'm assuming.
So to change the split amount, you'd have to get legislative action.
Correct. So I'm just going to be very clear. The timing is such that you will be asked to sign an agreement. There will likely need to be changes to the law, including adding more seats to the council, I would expect, for county representation. That will happen after the settlement, after you've been asked to sign.
How soon are they asking to sign?
End of the year, right? Greg?
Yeah, I think there's a workshop coming
January
up.
4th, I believe.
So we're not even gonna get to be able to negotiate out in the legislative session
No.
a better bargain for,
My guess is we'll have a closed session probably mid-December. Where things are going. Decide what we want to do.
Yeah.
well,
Yeah, it's curious, I mean, as taxpayers were paying for treatment and, all these other things that people that have, this substance abuse disorder, or certainly with the opioid addictions. So just makes me curious how they determined that, because is that then the money going to go to the state to distribute for these treatment programs? I mean, or to offset what we are paying as taxpayers to help people.
Right. So I think there are a lot of different things that we can spend our money on, and if we end up that the larger portion is coming to the county, we still have to, we will be audited and all of those things. We can grant out to local partners to do things, but you can see that treatment is one of the first things that that is allowable. This is one of the exhibits from the settlement. And a variety. So, I mean, I think there are ways to offset the cost to the taxpayer. But there are several counties that will have to sign on who will tell you that opioids is not their issue. However, substance abuse is. They will tell you that meth, usually it's meth or some other substance, is really what they're dealing with in their community. But they're still dealing with substance abuse and the costs of it. But it's not always being driven by opioids, but they would be able to benefit from these dollars as well if they're able to do some of the work the prevention work, and have some flexibility with the treatment if it's around substance use and abuse and not just MAT, for instance, because MAT is fairly opioid specific.
Or it started as opioid.
Right.
Right,
And
yeah. And now it's polysubstance, right? Absolutely, that
Because
happens
it's
too.
cheaper or whatever,
Mhm.
easier to get.
Because they can't get more prescriptions.
Yeah.
Mm-hmm. So, I mean, there's treatment, but there's support for people in recovery that can be in the community, can also be through Health and Human Services. We do a lot of work with the jail, obviously.
Yep.
I think all of these discussions are things that we're sharing as counties with other panel members and the AG's office. And I had a very good conversation with representatives of the Attorney General's office, not worked with them before. And really their motivation is just to get the most money for the entire state, so for the citizens, because the more people who sign on, we get a larger share. So they're looking to get, and everybody gets a larger share. We get a larger settlement because opioid manufacturers don't want to be sued again. I meet every Wednesday with them for like 3 hours, so if anybody has questions, I can update.
This is very good information. I'm trying to soak it all up in.
I know.
It's,
It's like
If you want, I mean, I've been sharing everything with Greg. If there's pieces, I don't think they're not public meetings, and I don't know if you'd want to join because they might be a little dry, but I can send you the materials as they come available. I think some of their overview slides are really helpful.
Yeah, Mr. Chair, I appreciate what you shared with us today. Just
Happy to do that.
like Derek said, to kind of absorb all this, so.
And I would say, I have been consulting with AMC for probably a couple months now, outside of these conversations starting and trying to figure out, because we're a little bit behind the 8 ball. There is stuff on their website as well. So if you want to see some of the agreements that North Carolina has done. I think that she has some presentation slides from different states and different plans. Because we don't have a plan for the state of Minnesota. That's not something that the council has done yet. We've really focused on what we would grant funds to.
So is your council supposed to come up with a plan and then present that to the legislators?
Council members are part of the group, but I think the whole group will, come up with a plan.
The disbursement.
And for the disbursement, and then I don't actually know where it goes, if it goes straight to the counties or if the state has to approve it first.
So as it stands right now, it's a 50-50 split.
Yeah.
Yeah.
But all the money goes through that account, which is a whole nother issue. Well, because once that account hits a certain dollar amount, it stops collecting fees, which I don't think it was any of the legislators, they'll tell you this, their intent to start the law in 2019 and stop collecting the fees 2 years later, just because it hit a threshold. I really think they thought they were going to be collecting for a long time and that settlement would take longer.
I think this surprised a lot of people.
It did. In a good way. I mean, I don't think anybody's upset that we're settling and being able to act on those large amounts of
I think
dollars.
there's a potential for receiving funds in 2022.
Yes, absolutely.
Yeah,
That'd be
usually things
interesting.
drag on for a lot of years.
So yeah, I guess at this point, I just like more information that I can get out there just to kind of get myself prepared to what pursues in December and January and maybe beyond, so.
You're very welcome.
Well, thank you, Sarah. Moving forward here, the HHS Advisory Committee minutes.
Right, so the HSAC Advisory Committee met on Wednesday, September 22nd. We have two new members, Kimberly Marquez and Todd Smith. They seem like they're going to be great contributors. Actually, Kimberly is a Wright County resident who works for Child Protection in Hennepin County.
Did she say when she's going to start working for the Wright County?
Yeah, we haven't quite hit her up for that yet.
Oh, okay.
We had a mental health update from Eric Nagel. We talked quite a bit about the presentation on the, in other words, that destigmatizing substance abuse disorders that META put out. Seems like it was very well received. We did go through our first iteration at the HSAC committee on what we were just talking about earlier today. People with more than 3 absences were sent the letter and followed that process. So we did remove 3 people based on the new process that we started. We talked about getting more members and maybe doing a press release for new applicants. We had an update from our public health task force. Talking about the Moderna booster. I think we are in the 2nd week of October, so we haven't seen it yet, but looking for information about that. Talked about some of the funding that we're seeing along the public health positions and just public health in general. And still that we are in the planning phases on logistics for a potential rollout for vaccines when the kids will be approved at ages 5 to 11. Commissioner Houston provided an update on the American Rescue Relief Plan. That 13 applications had been approved with a total of 36 requests, right around the 30 million mark, and that the broadband project had garnered 5,600 responses. I think there was a not-for-profit or somebody that's on the HSAC that was asking about being able to put in a request, so we provided them with Elizabeth's name. I provided a building update. We provided information regarding the 2022 budget narrative. And had some feedback about Thomas Allen, one of our contracted providers. And that was our meeting.
Yeah.
All right, very nice. So, director's comments.
And I do have a couple. The first one will be a question. We do have a proclamation from Governor Tim Walz regarding October 13th is County and Tribal Financial Worker and Case Aid Day. So in your packet, you should also have received a Wright County proclamation. So if you would like that read to you, we have somebody in our area here that can do that. Or if you would just like to look at adopting the resolution, I will leave that up to you.
I
You,
guess
you,
what we do.
you want to offer for someone to sing it?
Oh, I know. Is Michelle gonna sing
I'm
it?
surprised.
Would you like me to read it?
Sure.
So this Michelle Zeck is one of our 3 supervisors in our financial services area, and she will read our Wright County proclamation.
Perfect, thank you. Whereas county and tribal financial workers and case aides are dedicated to providing outstanding service to the people of Minnesota through their administration of public assistance programs, and whereas county and tribal financial workers and case aides are responsible for the prudent expenditure of millions of dollars annually and must meet high standards of job performance in determining eligibility for public assistance, and whereas the duties performed by county and tribal financial workers and case aides require they be well-versed in a number of areas in order to effectively provide services to clients and the general public, and whereas the nature of federal and state legislation necessitates that county and tribal financial workers and case aides continuously expand their knowledge, skills, and expertise related to their profession, and whereas it is important to recognize the valuable services county and tribal financial workers and case aides provide for Minnesotans, delivering culturally responsible case management and accessible community services with a person-centered focus. Now, therefore, let it be resolved that the Wright County Health and Human Services Board of Commissioners adopt Governor Walz's proclamation the 11th day of October for the citizens of Wright County. October 13th, 2021 is declared as County and Tribal Financial Worker Case Aid Day.
All right. We have a motion to,
I will make that motion to accept this resolution.
No, second it.
motion by Commissioner Hewsome, second by Commissioner Dahlheim to proclaim Wednesday, October 13th as County Tribal Financial Worker and Case Aid Day.
Thank you.
Mouthful.
Thanks for all the hard
Any
work.
further discussion? Hearing none, all in favor say aye.
Aye.
Oh, it's a resolution. That's right.
Ketchmark votes aye.
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 Thank you. I would just like to point out that we have 2 brand-new financial workers that just started today, so it's nice that they're going to be able to be here for our annual Financial Worker Day. And also just, and I think Commissioner Betch was pointing this out earlier, we have a great staff up on 3rd floor. They do a really good job. They're very, I would say, person-focused, and I just hear great things from folks when they get their issues resolved, and that things can go through pretty quickly, if not seamlessly, that they do it, I think, with respect and dedication to their job. So we have, I would tell you, a really good bunch of folks here.
So we gotta make sure Jess comes in that day and find the biggest donut, right?
Absolutely.
I've ordered one for a long time to find the biggest donut I can find.
Dairy-free donut.
Oh, yes,
Yes,
that's
the
it.
dairy-free,
She's
yes.
very particular.
Very particular. It's
Yeah.
complicated to find, I know.
A dairy-free donut? Is that what you said?
Yeah, it's not impossible, no. It'd be more impossible if you told me it had to be like gluten-free and dairy-free.
Yeah.
Then we might get really,
Egg-free,
yeah.
And calorie-free.
Here's a cup of sugar.
Also,
Sounds like my
I'm sorry.
grandkids.
Michelle Miller would like to give you an update on our drug testing, kind of our expenditures and our kind of new philosophy around drug testing.
So as part of our Navigating Hope, which we've been using our opioid dollars, I did send you an email with the 18-month allocation and the allocation for next year for Wright County. I had to look them up to get the exact amount, but part of our Navigating Hope and really just part of our wanting child protection to be more of that idea of coming alongside families and really providing the services and support that they need was to decrease our drug testing. And I've been telling Jamie, for 5 years maybe? That this was my plan every year, and no, we don't need to add more money to the budget, no. And every year we would go over and...
Exceeds our budget to the drug testing.
Yeah, like last year we exceeded it by 76%. So we were 176% over budget. So, lots of things came together, but really with the Navigating Hope, we're like, our focus is on engaging with families, so that engagement piece. And if we are engaging with families, have good relationships with them, we shouldn't need to drug test to the extent that we are. The work should be based on our relationship. And if they're telling us that they're using, we don't need to test. We just need to work with them on, okay, what's happening. And also we've been working on a harm reduction philosophy, which doesn't mean that the parent has to go from using to abstaining. It means we need to know together, we need to work out a plan that your kids will be safe. So we might have parents still using in the community, but their kids are not being neglected or abused. It's a really big shift, and we're excited to report that Marcia just sent our August financials, and we, last year at this time, our budget, or what we had spent in drug testing was $67,000, and at this point in the year, so end of August, we're at $38,000. So far, it's a reduction of $29,534, which is a 56% reduction from this year last.
I think the nice news about that, because I'm sure you're happy about spending less money, but we spent less money and the kids are as safe as they were.
Right.
So we don't feel like we're abandoning any safety aspects where the families are concerned.
And honestly, I feel like we're serving families even better, not at the same that we were years past. So we're excited about this. We're still, the ship it's a large ship because it's really almost everybody in child and family services. So that's about 60 people. So it's not like you can just flip a switch and people are suddenly like, ooh, harm reduction, that is fantastic. And I'm all about navigating hope. It just takes a little while to make that shift, but we're excited that this is one area that we can tell very clearly that we're making a difference and yet still providing really great services to families and kids.
Thank you, Michelle. The next item, I was actually involved with Michelle too. She was here, I think, last month and had just shared about Families First legislation that was passed back in 2018 and then in 2021 is supposed to be enacted. Well, I just got back from the MAXA conference that was at Rutgers this past week. We had really good information sharing and everything, but that Families First was kind of just, I would say, the downer of the conference. I mean, all the counties are kind of in the same place, so we just feel that that DHS doesn't have the widespread support for this. So I think it's just going to see how it plays out a little bit. Like if they're going to hold counties accountable when there really is no alternative for us using, the services that they're requiring us to do. So more to come on that, but just overall we had a good conference. Also, two more items. One item is, and I see Diane Rickens is with us. She, on her own recognizance and initiative, requested some grant funds from Alina Health, and we were informed last Friday, I think this happened really fast, that that Alina Health awarded Wright County Health and Human Services $1,500. This is to assist us in meeting or helping people with their homelessness needs. So thank you, Diane, and I think this will help our families and it'll provide us with some needed or some necessities for these families as we try to serve them. And thank you, Alina Health. And then lastly is our DHS audit. We've shared it with you in the past, just that Commissioner DeLayden and I both received a communication from the Minnesota Department of Human Services that they've reviewed our corrective action plans in 4 areas, with one being a material weakness, and that they've accepted that corrective action plan. They'll be keeping tabs on it. I did communicate with Christine Partlow in the meantime about the material, because that would be the most significant area, and it just says financial reporting. And she states, here's the finding, I'm pretty confident that it's not HHS. So I think it's some of our county financial reporting things that I'm assuming ERP will fix. So that is the sum of my comments for the director's comments.
Was it also on last year's? Did you ask her
I believe
that?
it's for the last 2 audits.
Yeah, that's what I thought.
They're the same ones.
Yep.
Yeah.
Yeah, I think this one's like showing up.
Although the annual EFT one, that one's new.
Yeah, that's a new one. I think it's one that I saw the corrective action plan. I think the action was just like just an instantaneous kind of thing. We decided to make a correction and it's done.
Yeah.
Some of these things I don't think we know about till they explain what it is they're looking for. It's like, yeah, we can do that.
I guess it's, is it a policy that we don't have for the electronic fund transfer delegation? I don't know, I'm guessing it's probably,
Yeah, and I think some of this, again, is, it's, I'm not sure, I have not heard that we have any issues with our EFT, other than I think that they would just probably need a sign off or something like that. Sometimes it's like, at what level did it get approved and things like that. So I think it's just making sure that we have our documentation where we can check things off, so make sure we're doing it. I think, and my understanding is that there was no significant, results to any clients. These are all internal processes that we need to make sure.
it was a well-documented process for.
Yep, absolutely.
So,
Yeah, we love these audits.
hey, they're thorough.
They're thorough.
Well, with that, do we have anything else to bring before the Health and Human Services Board? If hearing none, we will then adjourn here at 2:32.